So क्या क्या procedures कराएं शाहरुख खान ने आपके हिसाब से as a plastic surgeon? What can you say?
Definitely laser resurfacing of the skin. And fillers, Botox. Also to a very good injector, of course, because it doesn't look frozen. He can still emote, he can still give expressions.
Yeah.
Reconstructive surgeries were done on soldiers, on people who lost limbs, had disfigured faces.
Does it become like an addiction then in that case?
So for that matter, plastic surgery or cosmetic surgery is a slippery slope.
Okay, have you ever operated upon a celebrity or a public figure?
I have. For example, a 14-year-old boy comes to 14 with a gynecomastia. So
Okay.
gynecomastia is man boobs,
Yes.
has gynecomastia, but at school is being bullied.
What would you like to be? Famous or rich? As a doctor. Ladies and gentlemen, welcome to another episode of the Majlis show. Majlis is a place where we sit, chat, have a chill time and interact with some like-minded individuals. Like-minded individuals, but very successful people as well. So today, I have someone who I have a lot of things common with. For example, he comes from a small town, Meerut. I come from a small town, Aligarh. He has a lot of money in his bank account. I don't have it. So there's a lot of similarities, a lot of dissimilarities, but he's a very fun person to talk to. He's successful. He has a lot of followers on social media and he makes a lot of money because he's a plastic surgeon. So to add some bliss to this majlis, put your hands together. You can't, but you will by the end of this podcast. I promise you. For Dr. Faisal Ameer. Welcome to the show, Dr. Faisal.
Thank you, Faizan. Thank you for having me.
Plastic surgeon coming from Meerut. How did that happen? How does one decide that they wanted to be a plastic surgeon?
So there was no doctor in my family for miles, no relative, no friends who were doctors. But my parents wanted that their child should be a doctor.
Okay.
So initially it was just my parents' wish. And then gradually when I was doing well in school, I thought, why not? Let's, beat my peers, be a doctor. And then gradually things happen.
Okay. And then how did you decide to be a plastic surgeon?
Well, I was lucky enough to get good teachers. In my MBBS, I had an excellent plastic surgeon who was our teacher. So I was inspired to really, sorry. So I was inspired to see his work. He was very confident. He was good to talk to. He was well dressed. So I thought this is a person whom I want to really shadow, become when I become a doctor.
Okay. Who was that?
This was Dr. V.S. Singh. He was our professor in plastic surgery, and he was excellent at everything he did.
Tell me the truth. You knew his bank account, didn't you? And that's why you wanted to be a plastic surgeon.
He had the best car in
See, I told you.
In the campus, he had the best car. He had the biggest dog. He had, when he used to walk his dog, everybody looked at him as if he, a king is going with his lion. So yeah, I was impressed.
To cut the answer short, for money, basically.
He earned well.
I'm talking about you. For money, you wanted to be a plastic surgeon.
Not really.
Okay.
To start with, I was an artist.
Artist as
I
in?
used to paint.
Oh, wow.
And I did paintings in oil, watercolors, and I was really good at it. I would say that. And suddenly, I find myself in medicine, and I'm thinking to myself, how can I still pursue my artistic pursuit? And plastic surgery was one thing where art combines science. So I said, nothing like this.
Oh, that's amazing. Do you still paint, by the way?
Once in a while. I do calligraphy once in a while.
No, mashallah.
Yeah.
That's nice. I'd like to see some one day, inshallah.
Sure, inshallah.
Okay, moving on from this. मुझे ये बताइए कि plastic surgery, when we, एक तो मुझे word plastic से बहुत थोड़ा सा problem है. I'll come to that a little later. But plastic surgery actually होती क्या है? Because as a layman, what I understand is कि आपने किसी का चेहरा खूबसूरत बना दिया और ज़्यादा, एंड दैट इज़ प्लास्टिक सर्जरी. इज़ दैट करेक्ट और देयर इज़ समथिंग मोर टू इट?
So plastic surgery जो नाम है, this is a misnomer, because let's say urology, you know that it is concerning the urinary system.
Yes.
Neurology or neurosurgery,
Neurons,
you know that
right.
it's
Brains.
about the nerves, it's about brain. Any other branch, if you pick up gastroenterology, gastrosurgery, gynecology, so all names according to what doctors do. But plastic surgery is something, you can't guess what they are doing, and they think they are putting plastic in your body. But the name plastic comes from a Greek word, plastikos, which is basically meaning to mold. And that is what we do. We mold tissue, whether it is for reconstruction, whether it is for trauma, whether it's for aesthetic reasons. We mold tissue. We change the shape of tissue.
Okay.
That's what we do.
Okay, so it is not just for beautification purposes.
Beautification is just one part of plastic surgery.
Okay.
But reconstructive is a bigger part. It's that's what we are trained for initially, and then cosmetic surgery is just one part of it.
Have you always been okay with the name plastic surgery? Because, as you said,
Wasn't
plastic.
up to me, but if it had been, I wouldn't choose plastic surgery. It's something which doesn't give the right information to the public.
True. And it's undermining the effort because plastic is a negative word.
Yes.
Right? It's
Yes.
undermining the effort of the doctor who's putting in a lot of years into it.
Yes.
Right?
So plastic has now become synonymous with fake. So that person is looking plastic. That means it's fake, without expression.
Exactly.
So I feel it doesn't do justice to the specialty. And if it was up to me, I would change the name.
What would you keep
I would
as a name?
I would say reconstructive and aesthetic surgery.
Okay.
I would completely remove the name plastic surgery.
Oh, that's amazing. Reconstructive surgery. That sounds medical also.
It is.
Yeah, it is very nice. Okay. So how does face donation, that's one thing that I read about somewhere, कि face donation भी होता है. मुझे नहीं पता था. मुझे लगता था organs donate होते हैं different. Face donation भी होता है.
Now,
How does that work?
Yeah. So face transplant is one thing which is now well developed, and it is like limb transplant. And to start with, it was renal transplant, so kidney transplant, and then heart lung transplant, and then people started doing limb transplants for people who have lost limbs in wars, in accidents, and then they started doing face transplant, face and neck, sometimes face and scalp, for people who are disfigured by burns, by accidents. So the whole face can be transplanted, and the person, of course, has to be on immunosuppressants so that the body does not reject it. So it's something which is real, and as like any other organ which can be donated, face can also be donated.
So basically, if I remove my glasses, this part of my face can be taken off and given to someone.
Yes, with its vascularity, with its blood supply, with its nerve supply, so that it can be transplanted onto somebody who has disfigured his or her face.
So would that person look like me then?
More or less, yes.
More or less.
Yes.
So the
Except
bone
for
structure and
except for the bony base work, it will look a lot like you.
इतना हैंडसम लगेगा मेरे जैसा. Okay, moving on. लोगों को ऐसा लगता है कि once उनको ऐसा लग रहा है कि कोई डिफॉर्मिटी है उनके फेस पर या कोई प्रॉब्लम है उनके फेस के साथ, that plastic surgery can fix everything. Is it a fix everything solution?
Now, every science has its own limitations, and so is true with plastic surgery. Not everything is possible, not everything is doable, not everything is safe to do. But there, it has evolved over years. After World War I, that was the time when plastic surgery really came up like a specialty. Reconstructive surgeries were done on soldiers, on people who lost limbs, had disfigured faces. So plastic surgery became a specialty, and it has evolved since then. So many of these things are, of course, possible, but many of these things are just fake, coming out of Bollywood or from movies and TV, which are not really true. Maybe in near future or distant future.
Strangely, when you say about doable and non-doable, well, not a lot of people would think that a face swap, so to say,
Yes.
is possible.
Yes.
I mean, you've taken me back to those 90s wali films where
Face Off.
Face Off is the first film that came to my
Yes,
mind,
yes.
where the face was swapped, and not a lot of people thought at that time it was doable.
Yes,
But you say that it is now.
it
So
is
have you given that face transplant to anyone yet?
So, no. Face transplant has been done in a handful of number of cases, in a handful of number of countries. I was fortunate enough to see the first face and scalp transplant in NYU, New York. I was doing my fellowship at that time. So they were doing this case. I was just there to observe. And I didn't contribute except for seeing the case, but I was fortunate enough to see.
So basically, a mission impossible is possible now.
It is possible. Yeah.
Okay, moving on. Why do some people completely look natural? हो सकता है उन्होंने कराई है नहीं कराई है, you might debate about it, but there are people who you can look at and you can say कि भाई इसने तो definitely कराई है.
Yes.
Why is that? Does it depend on the surgeon or the person जिसकी surgery हुई?
I would say both.
Okay.
So it's more of the person who's injecting or who's doing surgeries or who's doing the procedure. That person has to stop at one point of time. But also as a client, if somebody says no, for example, you are a surgeon, I come to you and you say no, this is not possible or you should not do it. I go to another injector or another surgeon who injects three other syringes of filler into my face. Of course, I'm also responsible because I'm pushing my specialist, my injector to do it. And there are people, unfortunately, who will not stop. So it's both. It's contributory to from both sides, the client as well as the injector or the doctor who's injecting, going beyond the so-called natural appearance.
I've also noticed that a lot of young people now, they go to plastic surgeons. They are looking for Botox and things like that. We'll talk about Botox separately, but just to touch upon it. So what do you say to those people when they come to you? Say, for example, a 24, 25-year-old comes to you and say, I need this lifted, or I don't need wrinkles on my forehead or something like that, and I need Botox. What do you say to them?
Well, it's part of my responsibility to protect this young person from a treatment which might ruin his or her life.
Okay.
Now, I always try to convince them that this is not a point where you should start. This is not what you should be doing. You should be investing your time and energy in more constructive things, like skincare, for example, or putting sunblock, for example. That will go a longer way rather than getting some injections done, getting some fillers done. So it's my responsibility as well. So I give them time, more than the time which I give to a more older person who's coming for a fix. So a younger person, I feel that this is more of my responsibility to really protect them against doing a treatment which might harm them.
पर यहाँ पे दो सवाल आते हैं मेरे. आपने कहा कि वो हार्म करेगा उनको. So that means it is a harmful procedure.
I don't blanket statement that, but many of these treatments, if done at an improper age, if overdone, of course, they can be harmful. And any
किस regard में they can be harmful? In which regard?
So any medical procedure can have a side effect, whether it's...
Let's specifically talk about Botox right now.
Yeah, so Botox also is a medical procedure, can harm in so many number of ways. So it could be temporary, it could be studies have found out that Botox abuse can lead to muscle atrophy, which is not reversible.
Okay.
So of course abuse of these drugs can of course cause permanent damage.
Has there been a case where a young person has come to you rather, and has taken Botox for a long time and has regretted it?
So there are two situations which I see. One is that you start doing Botox at the age of, let's say, 20, and keep doing it for next 7-8 years, and suddenly stop it, and then you see your age, which is unmasked. Botox effect is gone, and you see yourself 7 or 8 years older, and then you think that this drug has made me older.
Okay.
But you don't realize that you have also aged 8 years.
True.
So that's one situation. Also, for a person who's doing it so frequently that Botox becomes almost ineffective, you start getting more and more units to get the same effect. And then, of course, Botox is not working, and then you really get frustrated. You keep on changing doctors, and every 3 months, every 2 months, you start finding a fix, and that is when they start regretting that they should not have started, or they should not have overdone this procedure.
Does it become like an addiction then in that case?
So for that matter, plastic surgery or cosmetic surgery is a slippery slope.
You're dodging the bullet here. Very simply, the smile said it all. Don't dodge the bullet.
So
Just tell me correctly.
I have seen, I get clients who are addicted completely. Not just because it's good, also because the way other people treat you. So I see a patient who was absolutely against plastic surgery, gets a small fix on the nose done, and then sees the change. Goes to the office, everybody treating differently. At home, the spouse, treating you differently, kids treating you differently, friends treating you differently. So now you keep on thinking, what else can you do? Can I do a liposuction? Can I do my breasts? Can I do, fat transfer? So that's where, things go wrong.
It's a very important thing that you've said, because where should you stop then in that case? If sky is the limit, and right now with technology and plastic surgery goes hand in hand with technology, with the advent of social media, where is it that you tell anyone to stop?
So, when a consultation happens, a new patient comes to you, you first think if the requested procedure is something that you can do, is it going to be safe? Is it going to harm the patient? And is it going to add value to his or her life? If all these check boxes are correct, and it's not just a mental, let's say, figment of imagination, he's not just thinking about it, it's not about a dysmorphic image that he or she is thinking about. So if that is not true, you are checking all the boxes right, and then you can do the procedure.
Okay, we'll come back to Botox a little later. You said plastic surgery can fix appearances and changes देखने को मिलते हैं, not just in yourself but in the behavior from other people. Then there are a lot of people who still are unhappy after doing plastic surgery. Why is that?
Now, again, it could be related to the procedure, it could be related to your self-body image. Now, if I think my appearance is not correct, no matter how many procedures I do, I'm not going to be happy about it.
Okay.
And it could be a procedure done wrong. So it could be both ways.
Fair enough.
So if somebody does a rhinoplasty, for example, if the nose is still not up to my expectation, I would not be happy about it as a patient, as a client.
But expectations manage karna is also a thing, right?
It is a big challenge. Now, compare it to any other specialty in medicine. There is a renal stone, you remove the stone.
You're done.
You're done. Pain is gone. You expected that the pain will go, the pain is gone. But expectations in plastic surgery are entirely different. And everything is on the surface. So you go to your office, your colleague tells you, no, I don't like this nose. If it was a little bit smaller, it could have been better. You go home, your spouse tells you something else, your friends tell you something else. You put a selfie on social media, comments from strangers about your nose can be, anybody can comment because it's surface work. Everybody can see what is going on. Compare it to any other specialty. Even if it is a brain tumor, you operate a brain tumor, nobody knows what has been done inside the brain. Of course, with all due regards to all other specialties, our specialty is on the surface. And anybody can comment, whether they know nothing about that branch, they can comment. So that is why delivering and matching it with the expectation of not just you, of your friends and relatives and social media, it's so difficult.
I'm going to put you on the spot here, because you said somebody at your office points out to your nose and says maybe it's a little shorter. So aren't they objectifying it? Objectifying the parts of your
100%.
body or your physicality,
100%.
physical appearance?
100%.
So isn't this a side effect of plastic surgery?
But, all of us are guilty to that. If I think that, I'm going to treat, let's say I go to a hotel, for example, at the reception, I see, with due regards, an ugly person and a beautiful lady. I'm going to treat them differently. Even if I think that I'm the most, impartial person, I'm not going to do that. But at the back of my mind, as a human tendency, I'm going to treat them differently.
Okay.
So it's not about objectifying, but it's about, let's say, human nature. treating people differently based on their appearance. And all of us are guilty of it.
Yeah.
Anybody who says he's not or she's not, it's not true.
As you said earlier, it's a slippery slope, right? Okay. Have you just from the top of my mind, have you ever met someone and thought कि यार इसकी plastic surgery बड़ी खराब हुई है? You go to a hotel, you see a receptionist, the
So
thing
many
that you were
times.
mentioning.
So many times. So many times.
So do you tell them or do you just hide
No,
it?
never.
You
Because
don't tell them.
it's just going to add to their agony.
Mhm.
I'm sure if something is so obvious, and somebody it's
Maybe
already,
it's not obvious to others. Maybe it's not obvious
Yes.
to her.
even then it's not my job to go and tell them that it's a bad job done.
Maybe it's a new client to you. Do you think like that?
No, I
Or
don't.
do plastic surgeons think like that?
I wish that nobody does that, but
People
I've
do.
seen people do that.
It's a business eventually, unfortunately, right?
Unfortunately, yes.
Okay. So, आपको लगता है कि प्लास्टिक सर्जरी नहीं होती तो सोशल मीडिया एग्जिस्ट नहीं करता मोर और लेस? ऑफ कोर्स कंटेंट बन रहा होता, ऑफ कोर्स लोग फोटोज पोस्ट कर रहे होते, बट द वे दे आर डूइंग इट राइट नाउ.
So one thing which has really boosted the business of plastic surgery and cosmetology is the appearance of filters. Now you see yourself with a filter, with a smooth skin, with bigger eyes, with a smaller nose, with a defined jawline. So all these filters are available. All of us have tried, once in a while. So this has really boosted plastic surgery because people became more insecure about their appearance, and they thought if we got a little bit of better jawline, it would be so good.
And unfortunately, they don't want to work in the gym for that, right?
Yes. And once you post that picture and you see the number of likes with a filter, without a filter, and then you realize, no, this filter should be in the real life. I should get this done.
So basically, there are two things that have boosted plastic surgery. One is laziness. The other one is social media, right?
Yeah.
That is what you're trying to say.
Yes.
Okay, we'll come back to that
Yes.
little later because I have a lot more questions around that. Have you ever... Okay, one thing which we were talking about off air. If someone comes to you and they want to discuss how they look, how do you judge whether that person can afford that plastic surgery or not? Because it is very expensive. How do you do that?
So
Because there has to be a way, no? If someone comes to me for an event, say for example, and they want me to host, sometimes by just looking at them, I know they can't afford me,
yeah.
right? So does
So-
that happen?
So it's more of about I would say profiling. You see a person, not just
I can
not
see
just
why
when-
you are a doctor and a smart one at that. Well done, Dr. Faisal Ameer.
Thank you.
Okay, please go
I'll
ahead.
take that compliment. Well, first part of my job is to see whether this patient has a dysmorphic image. He's thinking wrong about themselves, or she's thinking wrong about herself. And the second thing is she just doing it for
For the heck of it.
the heck of it?
Or maybe peer pressure.
Yeah.
That is also a thing.
Now, sometimes, you see people in the middle of separation, middle of divorce, sometimes loss of job, and they think that plastic surgery could be a good fix or a quick fix of all the worries, all the problems in their life. So my job is also to detect this at a very, very early age and not do procedures, because I'm going to be in trouble. They are never going to be happy. And this is going to just create, trouble for me as well.
So, do you work in conjugation with a psychiatrist or something like that? Because that
So-
would be, I think, the next logical step. If someone thinks that, oh, on the inside I'm not beautiful, but I want to be beautiful on the outside, right?
So ideal situation, yes.
But does it happen?
in real life, if you tell somebody to see a psychiatrist, it's quite derogatory, unfortunately. So we call them counselors rather than, yeah. So we
Smart.
say that, yeah, we say that you need to meet our counselor, and he or she will decide whether you are eligible for this procedure or not, when we see strong suspicion that this person is doing it just for the heck of it.
Say, for example, 10 people come to you for discussing something they want to do to their face, right? How many of them do you turn away usually out of 10?
I would say 3 to 4.
And how many the counselor sends back?
Hardly any.
Hardly any?
Yeah.
Okay.
If a person has gone to a counselor, usually they will take care of the person and the person will no longer need.
What about the hospital? Wouldn't the hospital come back to you and say, business अच्छा खासा आ रहा था आपने मना कर दिया?
Yeah. So also the corporate culture and the pressure of performing as a doctor, as a surgeon is also going to affect your work. Now, fortunately enough, this has never happened with me because my work has always flourished.
Thankfully.
Alhamdulillah. Alhamdulillah. So I've never been asked that you've done less number of cases. So I've never been under that effect. But of course, this is there. Unfortunately, this is true. It's there in the market. People are questioned whether how was the last month for you. So
Wow.
this is
So basically sales वाली job की तरह हो गया है, targets,
unfortunate.
right?
So unfortunate. Yes.
So do you have a target?
Not me.
Okay. Okay. आँख मार दिया आपने, काफी है.
I work for
Let's
myself.
move on. You work for yourself.
Alhamdulillah.
Okay, that's good. Alhamdulillah. Okay, so what is that most heartbreaking reason जो किसी ने आपको दिया हो to get a surgery done? कि मुझे surgery इसलिए करानी है, जो reason उसने दिया हो, that was heartbreaking. Has that happened ever? What did they say?
So many times, behind a very trivial surgery, which you might feel that it's so unnecessary, there is such a background story.
For example?
For example, a 14-year-old boy comes to 14 with a gynecomastia. So gynecomastia is man boobs.
Yes.
And a child who has just is through puberty at the age of 14, still hormones are causing havoc, so has gynecomastia, but at school is being bullied.
Oh, wow.
Now his friends are calling him names, the whole class is making fun of him. So what do? Do you operate this patient, or do you just say that this is just hormones, it will just pass, after 4 years, 3 years you will be okay? What do you do? As a parent, parents think that he should be homeschooled. As a doctor, what should you do? Scientifically speaking, when the puberty passes on, his gynecomastia might just disappear completely. Should not be done, should not be operated. As a doctor, what do? Is this a social indication? Is this a scientific indication of operating this child of 14? Should you remove these, man boobs? What should you do? That's where you have to really think what is your indication. As for me, I think that this child should be operated.
Okay.
At the age of 14, if he doesn't go to school, or if he gets bullied for any reason, and is hating school like anything, he doesn't want to go to school, that is the time when you should just do a liposuction, just remove the fat component, just make it flatter, so that he can resume his social activities. This is my opinion. Many of people might not agree.
I respect it, because my next question would be, he's not allowed to have a license, a driving license. He's not allowed to take decisions without his parents.
Yes.
And how can he decide to get a surgery
So
done?
all people who are minors for surgeries,
Your
their parents have to consent. Of course, they have brought the child. If I tell them that, of course, this will pass, these parents are not going to accept it. What are you going to do? It's a very difficult situation. It's ethically very difficult to, morally justify your thing.
Emotionally also for a doctor.
So difficult.
Yeah.
So difficult.
So do you take emotional baggage back home after these things?
Unfortunately, always. As a surgeon, whenever, let's say a wound is not healing, I've done a surgery, I lose my appetite. Even at this stage, I've done surgeries.
How many surgeries you might have done by now?
More than 15,000 surgeries.
15,000
More
surgeries?
than that. 15,000 is the logbook that I have.
Wow. And even after then, it's not satisfying.
If a patient texts me that, last night drain was 100 ml when I was expecting 10 to 15 ml, I lose appetite. I can't eat. It's taxing. You tend to learn over time, but it's still
And
with you
that
always.
might happen with most surgeons, but more so for plastic surgeons. That is what you're saying.
With most surgeons.
With most surgeons.
Even when I was a general surgeon, so I started my training as a general surgeon first and then plastic surgery. So you see a patient who has some complication, you are devastated.
So patients के counselors होते हैं, doctors के भी होते हैं?
There are in good hospitals there are people who avoid what is known as burnout, because for different specialties, studies have been done to see what is the burnout rate for emergency doctors, for plastic surgeons. There is a high burnout rate.
Okay.
So
Have you been to a counselor?
never.
Why not?
I never.
If you take such emotional baggage back home, then why not?
No good counselors for doctors, unfortunately.
Really? Maybe a psychiatrist who can treat you as a patient.
Now,
Just asking.
yeah. So psychiatrist also doesn't have the time to counsel you, unfortunately. So
Okay.
the shortcut which a psychiatrist has is to give you a prescription.
Well, that's sad.
You don't want to be on a prescription
Yeah,
ever.
true.
And especially when you need all your senses to be on top-notch alert while doing surgeries, while doing, you have to perform in that, 1 hour, 1.5 hour, 3 hour surgery. You don't want to be on drugs. So,
So if you open your hospital one day, you will have proper counselors for doctors.
inshallah.
Inshallah.
Sounds
Okay.
so good.
है ना? वहाँ पे social media की ज़रूरत पड़ेगी. I'll also come in. Okay, moving on. Have you ever operated upon someone and later wished कि यार नहीं करना चाहिए था, गलती हो गई?
So many times. Now, this happens when sometimes you don't detect what is the motive of a patient. Why is the patient getting a surgery? And this happens so frequently. There's a person who's not, giving you emotion to say that they are going through a rough patch in life. And that's when you see that this is a mentally stable person and doing a procedure and because it's indicated, it's safe, health-wise they are good. And you do a procedure and the patient is not happy with it. And keeps on, texting you, calling you that they're not happy, coming for reconsultations. They want more, and they're not happy. So that's when you realize that this was the initial consultation wherein you should have really pointed out, you should have detected that this person is going through a rough patch and is doing a surgery for some other
कोई
reason.
particular example है आपके पास ऐसा?
So many times.
Without
so many
without
times,
taking any name.
So many times.
Okay.
And this rough patch specifically is spouse separation or divorce. That's the time, if you do a surgery, almost always you see yourself in trouble.
But that time ज़्यादातर लोग आते होंगे सर्जरी के लिए आपके
बहुत
पास.
लोग आते हैं.
Because मुझे मेरी ex के boyfriend से ज़्यादा handsome बना दो. Types,
And also
Does that happen?
There is some handy money at that time.
हाँ, alimony.
Alimony. So that's the handy money you want to spend on yourself.
पर ऐसा बोला है specifically किसी ने आपको?
So many times.
कि-
So many times. Yes.
See, this is the picture.
picture also.
Really?
Yes.
What do you say to them?
That's when
I think
you know
plastic
that
surgeons को psychiatric degree भी लेनी चाहिए,
they
psychiatry की,
should, they should.
है ना? Because you have to counsel people
yeah,
as well.
unfortunately, there's just one chapter in the beginning of the book. That's the plastic surgery textbook, which we all follow throughout the world. First chapter is on counseling and the psychological aspects of plastic surgery. How to detect what are good clients, bad clients. So that's the first chapter. So we should.
Unfortunate. तो आपने बनाया किसी को उनके ex के current से ज़्यादा खूबसूरत?
That's where you don't want to be in that space.
But have you done that? Have you done that? Now this person, say for example, had loads of money, and you were like, इसको कराना ही है तो ठीक है, मैं तो पैसे कमा रहा हूँ ना.
But
have you
most
actually
of-
made them more beautiful than the ex's current?
see, some people will just be happy with doing a procedure, but that's a smaller percentage.
Yeah.
Most of the people, they are not going to be happy because it's not going to fix their life.
Yeah.
It's not a quick fix to their relationship problems. That's the issue.
Basically, it's like when you're feeling sad and you're like, कुछ नया खरीद
Shopping
के
कर-
लाता हूँ, है ना?
Online
It's like that.
shopping.
It's a very quick fix,
Yeah,
but वो उतना ही quickly चला भी जाता है.
absolutely. You get that dopamine surge
So plastic surgery is like that
Yes.
for most
And
people.
you should be avoiding that. As a surgeon, you should be avoiding that because you are going to end up in trouble.
सर आप बहुत ही अच्छे आदमी हो, पता है? You know why I'm saying this? Because आप लोगों को लिटरली मना कर रहे हो मत कराओ प्लास्टिक सर्जरी. मैं प्लास्टिक सर्जन हूँ, मुझसे मत कराओ प्लास्टिक सर्जरी. That is what you're saying.
Recently, I had a talk in a conference how not to get plastic surgery. That was the topic of my talk.
Okay, okay. Nice. I like
Thank you.
this. अच्छा, सबसे ज़्यादा बड़े डेंजर्स क्या होते हैं प्लास्टिक सर्जरी के, स्पेशली डन ऑन अ फेस, से फॉर एग्जांपल?
Now, face is like an electronic powerhouse. Like you open a CPU, you see all these connections going on, all these small wires going on everywhere. So face is like that. There are nerves, there are blood vessels, arteries, veins, and it's all like a meshwork. Any small injury to a nerve will lead to permanent disfigurement. One side might move, one side might not move. So it's such
Especially done at a young age, that can be devastating.
so surgeries, of course, they should not be done at young age, especially facial surgeries. So this can lead to
So
lifelong.
after what age would you suggest someone to take a surgery, especially for plastic reasons?
For different procedures, different age group, I would say.
Specifically for plastic reasons कि मुझे और खूबसूरत बनना है.
Let's say rhinoplasty, for example.
Okay,
Minimum age, I would say, is 17.
okay. So not before 17.
Yes.
Okay. So rhinoplasty 17 के नीचे किसी को नहीं करानी चाहिए.
नहीं करनी चाहिए. Unless it is so disfiguring, again, causing social issues. That's a different.
And this is one of the most common surgeries as well.
Yes.
But this is one of those surgeries that gets botched up easily also.
So easily, yes.
Have you botched up a case ever?
That's such a.
Oh, the pause that you took. You have, haven't you?
Now, of course, I will have my own share of complications. Just by the sheer number of cases that I have done, some percentage of those cases are going to have complications. Now, the term botched is something which is more of like an ignorant surgeon doing a procedure and leading to devastating side effects or results. Unfortunately, this is happening in countries where the healthcare is not regulated, and doctors do whatever they want to do. Fortunately enough, it's highly regulated in UAE. So you cannot do a procedure just by thinking that let's try to do this procedure. You have to do it on scientific basis, based on recommendations, international recommendations. So that's not which happen a thing which happens in UAE. But yes, I've had my own share of complications. Over time, you try to find things which can be fixed very early, especially pre-operative workup. So if a patient comes to me, there are things which I can tell the patient not to do. Let's say smoking, for example. Initially, you feel that smoking is just smoking, right? It's just a habit. Some people have, some people don't smoke. So later on, you realize that so many complications are linked to smoking that you really ask your patient not to smoke.
For example?
So smoking causes vasoconstriction, which is shrinking of blood vessels temporarily.
Okay.
So you smoke one cigarette for 24 hours, your blood vessels, they will just shrink.
Just one cigarette.
Just one cigarette. Now, for a person who's doing it on a regular basis and has been a smoker for a long time, these small blood vessels, they stay in a state of constriction. So we need blood supply for wound healing. We need blood supply for, taking away the edema, taking away the swelling. If that is not happening, our healing time, recovery time is just increasing, right? So complications are higher, bruising is higher, swelling is higher, wound infection, wound dehiscence is higher. So this is just going to multiply. So initially, pre-operative workup. If a patient comes to you, you would like to first prepare that patient medically as well, not just mentally. You want to prepare that patient mentally. You do all blood work, all investigations, you do anesthesia checkups just to make it safe. So your complication rate just goes down, as you grow in the specialty, as you become more and more mature as a surgeon.
All right. One thing I'm going to be bold enough and say this, कि ये सुनने के बाद, I can tell you this, cigarette doesn't make you look cool. It makes you look nama cool. Okay, moving
Oh,
on.
well said. Fantastic. I'm going to use it.
Yeah, please do. Well, moving on from this, we were talking about rhinoplasty. So there are a lot of celebrities, actresses mainly, who've done it, right? And they have been botched up also in a lot of cases. मतलब मुझे ऐसा लेमैन पॉइंट आउट कर सकता है एंड आई टेक अ नेम ऑल्सो फॉर एग्जाम्पल शिल्पा शेट्टी ने जो इनिशियली सर्जरी कराई थी इट गॉट बॉच्ड अप कोयना मित्रा फॉर एग्जाम्पल करियर ही खत्म हो गया क्योंकि नोज जॉब खराब हुई थी सो यू नो हु आर दो सेलिब्रिटीज जिनको देख के लगता नहीं है कि उन्होंने कराई है बट कराई है कैन यू नेम अ फ्यू
So most of the celebrities, even if they claim that they have not done procedures, they have done procedures.
समथिंग और द अदर
Yes. Whether it's a nose job, whether it's some filler, some Botox is so common that asking somebody if they have done a procedure or not is actually a wrong question.
and it's affordable also, right?
Yes. Yes. Especially for them, it's something which they can do it anywhere. They can travel to US, do it there, travel to Colombia, Brazil. They can do it anywhere. So they do it at a place where they don't get exposed. They do it in privacy.
बट अगर करते हैं तो छुपाते क्यों हैं?
They just want to,
मतलब
make it as a
There's
statement.
a difference we can see in their face, right? We know they have done something.
Yes.
Why is it still
Taboo.
शर्म की बात या taboo
Yes.
to actually hide it कि हमने सर्जरी कराई है?
So in most societies, it is still, people look at it like a negative thing to do a surgery or do a procedure. But things are changing, especially with social media, especially globalization. Things are changing. But of course, in celebrity culture, they would not like to say that for their appearance they did a surgery. So they are completely natural. It's just natural beauty, natural talent.
Natural beauty like Shah Rukh Khan's, if I may point out. He's what, 60 almost now?
Yeah.
And there's no mention of him doing any surgeries. No mention. But do you look at him and see that he has done it? Do you?
Definitely.
So क्या procedures कराएं शाहरुख खान ने आपके हिसाब से as a plastic surgeon, what can you say?
Definitely laser resurfacing of the skin. That is a definite.
What does it do?
It resurfaces the skin. It makes it smoother, makes it more uniform, fresher, and it takes away the pigment, irregularities, tightens it up, makes you feel
Fair enough.
younger. And fillers, Botox, also to a very good injector, of course, because it doesn't look frozen. He can still emote, he can still give expressions.
Yeah.
That is where a role of a good injector comes into play.
And
To
money
balance. Money also.
Money also, because he's one of the richest actors ever.
Yes.
Like ever.
Yes.
Very interesting. Okay. Priyanka Chopra, Anushka Sharma are the two people who come to mind. Anushka Sharma came on Coffee with Karan right after her surgery, and she got lip fillers done, I think.
Yeah.
Lip fillers, I think, is not a huge procedure. But
not.
उसके बाद भी botch up हो गया था. So what was Anushka trying to do? Was she trying to save money, or was she trying to garner some attention doing this? What do you think?
It's so strange because lip filler nowadays is hyaluronic acid. And these fillers can be dissolved within 24 hours.
Okay.
So if it goes wrong, you inject another drug, which is an enzyme to dissolve it, and within 24 hours, it's gone. So I'm not sure why, so much of drama behind this. If your lip filler has gone wrong, if you feel that it's not natural, if it doesn't look normal, you can just get it dissolved. Unless they've done it at a place where they've done something else, injected some silicone oil or something. I'm sure they have not done it because as a standard worldwide, hyaluronic acid fillers are used for lips. And these are absolutely reversible. They can be you can inject an enzyme and make it go away within 24 hours.
Do you like someone, like as in, you look at someone who's got lip fillers done and you think that, they are looking very attractive?
Now,
Because I personally don't find that attractive somehow. Personally, that's just me. I look at someone, I know they have done it, and I'm like, what was the need of doing it?
yeah.
It doesn't even look nice. And it looks unnatural in most of the cases. The upper lip becomes bigger than the lower lip.
That's,
In most
that's
of the
completely
cases.
wrong. The proportion is that lower lip has to be 1.3 times the upper lip. That's the golden proportion of the lips. That has to be maintained while injecting. Now, if you come to know that fillers have been done, it's probably a bad technique. You should never come to know. For a person whom I feel that these are natural lips, full, beautiful, well contoured, you should not know that it has been injected. Like the classical saying is that plastic surgery should whisper, not shout.
Okay.
Nobody should come to know that you've done something. And that is true for fillers or Botox or surgeries itself. They should be subtle. They should be scar-free. Nobody should come to know that you have done. It should be natural.
चोरी किए तो पकड़ी ना जाए, basically.
Ekdam.
That's what you're trying to say. Okay, have you ever operated upon a celebrity or a public figure?
I have.
You can't name it, of course.
I can't. But
Doctor-patient confidentiality,
I
of course.
have.
Okay,
And
a big film celebrity?
I have done a celebrity from UAE as well.
Oh, from UAE as well.
Yes.
Okay. Guess करूं? No, I'm not going to put you in that pickle. अच्छा, जो हम बात कर रहे थे, just name 3 celebrities जिनके हिसाब से they should come to you for a plastic surgery, जिनका बॉचअप हो गया surgery. 3 of those जिनको आप देखते हो स्क्रीन पे एंड यू थिंक कि यार ये तो गलत है, इनको तो मेरे पास ही आना चाहिए था, इनके पास पैसे भी बहुत है, मेरा नाम भी अमीर है. So do you look at them that way?
Okay, so एक I would say कि, for example, if somebody finds out that Rekha has done a plastic surgery,
She has though, hasn't she? But she doesn't look like it.
that is what. So that should be my client.
Okay.
Looks natural, feels natural, but stays young.
But has definitely
miraculously stays young.
Yeah, I mean, उनको तो कुछ I think वो mythology से कुछ मिल गया है, वो पी भी लिया है उन्होंने, वो अमृत टाइप चीज होती थी ना, right? I think she's done something.
Elixir.
Yeah, elixir,
Yeah.
जिसको बोलते हैं. हाँ, and
So Tom Cruise, you see his pictures. Yeah.
but अब Tom Cruise दिखने लगा है थोड़ा सा,
No, of course.
Yeah.
But if you look at his peers, they've all retired, are doing grandfather jobs, roles, and he's still young doing action movies.
And the third one, quickly.
I think that should be it.
That should be it.
Yeah.
सलमान खान ने कोई कराई है
Salman
surgery?
Khan has done. It's a public knowledge. He has done in Dubai 3 hair transplants in a row. So it's a public knowledge.
Okay, that is the only thing you think he's
Yeah.
done though.
Yeah.
He hasn't done anything
But
else.
he works out. He's a good person. He does charity.
Does he anymore?
I
In
hope
the
he
recent
does.
times, so I
hope
don't think he
does.
is. Maybe it's for a role.
Yeah.
I move on to the next segment. I wanted to ask you this. What would you suggest if someone looks at you driving a swanky car, that the way you looked at your teacher, wearing swanky clothes, looking all golden, और आपके तो नाम में भी अमीर है, yeah? What would you say to that person when he comes to you and asks you कि मुझे plastic surgeon बनना है? What is it that you're going to say to him or her?
And this happens to me almost on a daily basis.
Does it?
We have, I work in Gulf Medical
तो
University.
क्यों आपने इतनी महंगी गाड़ी ली है?
नहीं
नहीं लेनी चाहिए थी ना.
no. See, it's more exposed. This branch has gotten so much exposure. I think World War I and II was one wherein the specialty grew.
Yeah.
And then this social media gave it wings. Now it is just flying because it has exposure. So medical students nowadays, they want to do it. And this is one of the most sought after, very difficult to get in branch. Getting matched in a residency is so difficult for cosmetic dermatology and plastic surgery. These are the 2 branches which are so difficult to get. Even in UAE, handful of seats and so many aspirants, it's so difficult. But then people don't understand how difficult it is. The way I was telling you that every person has a viewpoint about plastic surgery, even if they don't know anything, because your work will show. The way you do stitching on the surface will bring you compliments or criticism at the same time. So everyone will say that this is slightly better than what I saw in my aunt. It is worse than what I saw in with my brother. So this is not that good. This is very good. So it's quite difficult. It's quite competitive, not just with your peers. Forget your peers. Satisfying a client is so difficult. So that is where a medical student who is stepping into this branch should realize that this is not like any other branch. It is extremely competitive. Even if you are board certified, you're qualified. The day you start doing surgeries, you start getting judged, and that is where you feel the heat. So it's very difficult, it's very competitive, but of course I love it. I'm very passionate about it. I always tell my students to take up plastic surgery.
अगर ले सकते हो तो ले लो,
ले सकते हो तो ले,
मिलेगा नहीं तुमको, पर कर सकते हो तो कर लो, ऐसा. This is exactly what you say. I'm glad my mom wanted me to be a doctor. I'm glad that I'm not. Till the time I saw your car. Okay, next. This is this segment, and I'm going to put my fun glasses on for this segment.
Okay.
I'll ask you this or that, and you have to pick one. And you can answer maybe why also. Okay? So, nose job for beauty or nose job repair after injury? Which would you prefer to do?
No job after injury.
Which would you enjoy doing more?
I would enjoy doing it after an injury, after an accident.
But maybe plastic surgery would be required after the accident also.
Not really. If the primary treatment has been done properly, maybe no other treatment will be required.
Well said. Breast enlargement or breast reconstruction after cancer, say for example.
After cancer, of course, much more gratifying for the patient, for the doctor, much more satisfying and fulfilling, but also cosmetic. It gives you a lot of boost, a lot of confidence of, it changes your life. It's a life-changing surgery.
Of course. Face wrinkle treatment or fixing birth defects? I know the answer to this.
So I did a lot of cleft surgeries. This is something which is very close to my heart. I did a lot of volunteer work. I've done hundreds and hundreds of cleft lip babies in remote areas of India. So this is very close to my heart.
So basically you have done it
No
for
other-
free. That is what
I
you're
have
saying.
done it, yes.
You have done it for free.
Yes.
That was my next question.
Yes.
So you've done surgeries for free where you've not charged a single dime to anyone who's been...
Not one or two. I've done thousands of these surgeries.
Wow. So 15,000 में से 1,000 तो कम से कम यहाँ आ गए. And still इतना पैसा कमाया. तो करना चाहिए plastic surgery. Yeah. Okay. A tummy tuck for a slimmer waist or a surgery for burn scars?
Both equally gratifying. For a surgeon also.
Which one is
for,
more difficult?
Burn scars. Abdominoplasty is a very basic surgery. I think, of course, it needs finesse and to give the perfect result. Of course, it requires a lot of experience, but it's a very simple job. It doesn't have all this thinking and coming up with answers. Burn scar doesn't follow a rule. You can get a scar which completely just does not give you any answers immediately. So you have to think, you have to go back to your basics, what you can do about it. Sometimes take opinions from your peers. So that's what.
What would you like to be? Famous or rich as a doctor?
I think money comes with fame. So being
said.
famous would be a better thing.
क्योंकि पैसा तो मैंने कमा लिया. In fact, I am one of those few people जो पैदा होते ही अमीर बन गए थे क्योंकि मेरा नाम ही फैसल अमीर है, right? So मुझे चाहिए fame. That's what you're trying to say.
Fame होना चाहिए.
Fame होना चाहिए. And that is why the kind of followers that you have on Instagram. मैंने एक फोटो डाली थी इनके साथ में, by the way. And he collaborated with me. ऐसा 10 मिनट में 500 लाइक आ गए थे उस पर. मैं 18 साल से रेडियो में हूँ, मीडिया में हूँ. मैं मेहनत करता हूँ, एक फोटो डालता हूँ और फिर मैं वेट करता हूँ उस पर 500 लाइक कब आएंगे. So you're already famous.
God has been really kind. God has been really kind.
Yeah, to you. Okay. What do you prefer more? Not covered by insurance or often covered by insurance?
Often covered by insurance. I would wish that all procedures which are done for medical reasons should be covered.
But ऐसा होता नहीं है.
A lot
Usually
of-
plastic surgeries, especially cosmetic surgeries,
Cosmetic surgeries will
तो
never
है
be
ही नहीं
covered.
covered.
But then reconstructive also, as soon as they see that a plastic surgeon has requested them, they would just reject it. And then back and forth, what is the reason? Why is the patient doing it? And I keep on telling them this is not for cosmetic reasons. This is done for a reconstructive process. And even sometimes skin cancers, they keep on rejecting. And the skin cancer grows over time. 3 months, the cancer is growing, and we keep on asking insurance
How can the
companies.
patients be helped in this case, Dr. Faisal?
Now, the backup mechanism which we have found out is charity. And there are very good charity organizations in UAE who help patients. Now, not many people come to know about this, but we have to, of course, guide them that if you cannot afford, of course, healthcare is extremely expensive. So, if you cannot afford a treatment, you go to a charity. It's not that a very poor person who doesn't have food to eat should go to a charity. If there is a surgery which a person cannot afford and it's for reconstructive or let's say a medical purpose, the person can go to a charity and get approval from there and then do the procedure.
All right. Okay. So that ends our this and that. The next set of questions, which my producer really loves, is because she wants me to sound dumb on the show, is dumb questions you should never ask your surgeon before undergoing surgery. Okay, so my first question to you is, if I show you a pic, I talked about it. If I show you a pic of my ex, can you make me look better than their new partner? Can you?
I can try, but better to go to another plastic surgeon that I know. I'll just give you his number. Just go to him.
That means you're saying I need a surgery.
No,
That's so mean.
I'm just saying that don't do this surgery with me because I'm going to end up with trouble. So I'll send it to some of my not so good friend.
Okay.
I'll give his number.
Then I'll show you the picture also. Okay, can you give me... Oh, this is something amazing. So I've had 2 surgeries, unfortunately. Let's not go into the details. But the best thing about those surgeries was anesthesia. The kind of sleep it gives you. It's so peaceful.
Yes.
Dreamless sleep. And you just wake up so fresh. You're groggy because of the anesthesia. But it's like all your pain is gone and you're relaxed.
Yeah.
So my next dumb question would be, can you just give me anesthesia for life so I never feel pain?
Wow.
That's an answer enough. See, I told you these are really dumb. Okay. This is good. Will my Botox freeze my face so much that I never have to fake smile at my boss again?
It can. If you wish to, I can freeze your muscles so much that you will become completely wooden.
Okay. What happens if I sneeze during my nose job?
So during nose job, again, you will be under full anesthesia.
Okay.
You cannot sneeze. You have nothing.
So if I'm sneezing, then my anesthesia is not working, basically. Right?
Yeah, you are not under anesthesia.
Okay. Acha, next. Can you put my nose back after a surgery if I don't like the new one?
Usually these these procedures are irreversible.
Okay.
You cannot go back to your original. So that is why it is so important to do research, to be careful of what you want, what you wish for, and to choose a doctor, choose a hospital, choose a country where you should be doing this procedure. But then sometimes if things go wrong, they can be fixed. But going back to its original shape and form, never possible. Sometimes I tell my patients, if they come with an injury, they ask me, will my finger be exactly like it was before the injury? I tell them, for that you have to go to the workshop. And they get confused. What workshop? Said, where you came from. So it's not possible.
All right.
Yeah.
Last question to you, Dr. Faisal. No, actually, second last, because I'm having too much fun. If you're not a doctor, what would you be? Don't say a painter, because I know that already about you. What would you be?
In COVID, I came to know, I rediscovered myself that I could do carpentry. So probably a carpenter.
यार कोई चीज बची है आपसे आप जो नहीं कर सकते हो? अब टाइम कैसे मिलता है ये सब
I was
करने
just
का?
frustrated during COVID, nothing to do. I had to do something.
Okay.
Yeah.
So you still do it now?
No, not anymore.
No, not now. Okay, fair enough. One mic drop moment. This is something I ask every guest at the end of the show. What is it? What is that moment in your life that you would call a mic drop moment? हो गया बस. I have achieved everything in life. इतना तो मेरे माँ बाप ने भी नहीं सोचा था कि मैं करूँगा ऐसा.
So each day of my life, I am always thankful to what I've achieved, what life has given me, what God has given me.
आप बहुत मक्खन लगाते हो ना टोस्ट पे, ऐसा?
I just hope कि ये day कभी ना आए मेरे लिए.
Okay.
I should always feel hungry for more. I should always feel that I've underachieved. So I should always strive for more to get myself better, to achieve more.
Do you think you have not achieved anything yet?
Absolutely. I am.
Not at all. Nothing. You have
of
achieved
course,
nothing.
Of course. I'm so thankful of what I have. I remember that I used to ride a scooter for most of my college. And I'm so thankful to my father that he could afford a scooter at that time. And the car which I drive now, I look at my car daily and I remember my father. I just thank Allah and I thank my father for making this possible.
Do I see tears in your eyes? I do, right? I feel for you also.
Thank you.
Because I feel the same way as you. Because I would have never thought where I am today to reach here. I mean, I'm not saying I've achieved everything, so I resonate with you. I might not have achieved anything at all, but I resonate with the feeling. Thank you so much.
Thank you.
Dr. Faisal Ameer. You're not just Ameer in the name, you're Ameer in your bank balance and your heart as well.
Thank you so much.
Thank you so much for coming on the show. It's lovely talking to you.
It was a pleasure.
Well, ladies and gentlemen, that's the end of another episode of the Majlis show. A beautiful conversation. We had some fun as well. And we promise you that we're going to bring you more of successful people, more of people like Dr. Faisal Ameer on the show. So you need to stay tuned. Till then, it's Allah Hafiz. Masalama.